Um, Thank you so much for the introduction, Mr. Lee. You've pretty much been accurate. I really want to keep this talk more about an actual talk than a presentation per se, because I'm sure many parents would have a lot of questions, and we can make this a very interactive session instead of just me talking and you listening and not having any dots clear. Yes, I mainly deal with a lot of return to sport protocols, pain management, and to a large extent prevention, and that is something I've gotten from the academy in itself. The very first time that we spoke when I came to Aruna was Mr. E's vision of trying to make sure that we prevent injuries from happening. At the same time, also make sure that we have athletes growing. If you see what we're going to be speaking about today is, and please always go ahead, unmute yourself to ask any questions that you feel you need for. But if when we are speaking of acute injuries and acute injuries and chronic or the overuse injuries that we talk about. So what happens here is, in an acute injury, any injury that occurs in a very sudden and a quick moment, and that particular impact led to that kind of an event is where we call it as an acute injuries. Now, in acute injuries, what happens is very sudden. You can't necessarily look forward to it. But whereas in chronic injuries, you'll see that they are developed over a period of time, and it usually happens because of repetitive stress on that region. It can be muscles, it can be tendons, it can even be bones, but it happens only over a period of time, and it leads up to that injury. Now, for example, if you can see this is you probably or maybe a child just hitting themselves against the rod or hitting themselves against the doorknob, hitting themselves against the vault, or it can be even beam, the ankle getting hit against the beam while landing. Now that can be considered as an acute injury. Whereas if it's a chronic injury, say the child goes ahead and complains of pain in the lower back today, and tomorrow, day after, there need not be any lower back pain. But again, in a day, maximum 2 days, there's again lower back pain. And this keeps happening over a period of time. There can be mild stiffness is present. Now, that is considered as a chronic injury. And that happens only very gradually and progressively it happens. So basically we call that as a group of micro traumas leading to one final trauma, and that is where we say that as chronic injuries. It usually happens, like mentioned, falls, collisions, or landing awkwardly, especially in gymnastics, or with a sudden force where somebody by mistake hits you, or just like that. But in chronic injuries, there's repetitive movements, there's excessive training that can lead to, meaning the training intensity can be a little too much compared to what the child can bear. Then that is where these kind of chronic injuries can come in. It can also happen that you've been overtraining or you've been heavily training for about a couple of days or 3, 4 days or even weeks together, and there's not adequate recovery between your training sessions. No, not enough sleep, not enough nutrition, not enough cognitive presence that is present, and because of that, also you can lead to a chronic injury. Here, in acute injuries, what happens is the pain pattern is very sharp. It's very intense and very immediate pain at that particular point. You can't necessarily look forward to any warning signs per se. But of course, if there is a sharp object that's lying around and someone is doing any physical activity, we're always going to say that, hey, keep that away, anybody can get hurt. But apart from that, we don't necessarily see any other warning signs per se. Whereas in chronic injuries, you will see a dull, aching kind of pain, and it usually worsens over a period of time and with activity. The usual early signs for that will be mild soreness can be present. And this mild soreness in general is easy, of course, and it's always present. And we'll speak a lot about soreness later. But then this mild soreness can persist for a very long period of time. Now, that is a key factor. And there can be stiffness that is present for longer periods of time. There can be malaise or tiredness or fatigue that is present for very long periods. All of us feel all of this, but the period of presence is what is going to matter here. This is the second thing, or rather, the next thing. Here in acute pain, what happens is there can be mild swelling in the region after the impact has happened. There can be bruising, there can be sudden loss of function, like loss of function in the sense of you might not be able to put all the weight on your leg, say if you have a sudden ankle twist, you will not be able to put all the weight on it. The body is going to protect itself by not letting you bear weight on it. And of course, there can be a severe pain. And in chronic injuries, it leads more like a dull aching pain, like we said, and this can be in the tendon regions. the regions where the tendons are going ahead and connecting to the bones. So if there's any irritation to the tendons there, we usually call it as tendonitis. There can be stress fractures. Basically, it's like a just imagine a box, and you just take a cardboard box and you just punch it once. Nothing really happens. Punch it twice. There's a small dent. Punch it thrice, and there can be a much more dent with a lot of creases around. So that's how even stress fractures happen. It doesn't necessarily, unless the pressure is so much that it completely breaks through. Stress fractures happen when there's a repetitive force that is being put on that region over and over again. That's when stress fractures happen. And very common areas where stress fractures can happen is your foot. There it can happen. To your spine, the vertebrae, the stress fractures can happen. Shin splints, all of us are fairly introduced to, because let's face it, in shin splints, what can happen is there's a lot of pain along the legs. Um, you please mute yourself, please. Right. So in shin splints, there's a lot of pain in the that's happening.
Lavanya, you
Now,
can
apart
right
from
click on
this,
them
what
and
happens
mute
here
them,
is the
please.
growth plate irritation itself. We're again going to speak about this in the growth spurt aspect of it. But in growth plate irritation, what happens? You'll get a lot of pain under the knee. You'll get a lot of pain behind the knee. Sometimes there's also hip pain that is present. So this is how it can be presenting itself. In gymnastics, it can look like a missed landing or a bad landing, a fall from an apparatus, an ankle twist. And in gymnastics, the chronic pain can also look at excessive impact from the walls, or even loading our wrists and loading our knee joints, and repetitive tumbling can lead to a lot of back pain too. So these are the scenarios where it can happen. Now we can try and prevent all of them by, at least the acute ones, by proper technique and very good safe equipment in the environment of equipment and supervision, making sure both the athlete is very active and being present so that they're aware of the surroundings, the coaches making sure that the surrounding is good enough and supervised enough for the technique and work around it, and good warm up plus cool down. The cool down is left out here, but then warm up and cool down strategies are extremely important in order to prevent acute injuries, and cool down strategy all the more so needed for your chronic pain prevention. So we can prevent them with even load management. So chronic pain can go with making sure that the loads that we're giving on to our athletes is not the same on an everyday basis. Good micro macro cycles have to be taken care of. If that happens, it's a lot easier for us to manage this or rather prevent it completely. Good rest days, strength training super important. Without strength, you will not be able to do skills, and gradual progression of both strength training as well as the skills training. This is important. Okay, so I hope you guys got a simple understanding of acute and chronic pain. I want to do a small work, like let's just, let's interact a little. So let's identify an injury of your child. Okay, I'm going to give you all 5 minutes. Please unmute yourselves, talk to me. Whatever it is that you want to say, there's no right, wrong answers. We can work with it. So please unmute yourselves and go ahead and tell me what could be an injury that your child is facing right now, and is it an acute injury or a chronic injury? Anybody? Okay, I see parent named Dharani. Would you like to go ahead and say something? Mr. E, do you want to do it?
Hi, Lavanya. This is Sanjit here.
Hi.
Hey. So
I'm Nantita's father. So she's she's been doing this for some time now in gymnastics. And recently, what we observed was when she changed from level 1A to 1B, and there was some intense training happening. We noticed some muscle soreness, which was prolonged. As in, usually it happens only for a day. So last time it happened like 2 days or so, and then she had to miss the school and all because she was not able to move around.
Mhm.
And we consulted someone, and I think we were told that it is DOMS. It is
Mm.
typical after that. So those are some things we would also want to prevent. We did get some tips from the doctor whom we consulted, but that's something which is largely on the hydration side and the food side. But yeah, we would like to know more to prevent such things, or be prepared for such things. What is that we should be doing? Because this is something, if we have to if we have to expect, then we should be prepared for that.
Definitely. We will be talking about soreness and what is pain and what is soreness and how to deal with that a little later as well. But
Sure.
if you would like to take this up, Sanjit, like for example, so when she shifted from the different levels is where
Yeah.
she started feeling the pain. Now, would you go ahead and put that in the acute injury bracket or the chronic injury bracket?
I didn't get the last part.
Would you be putting that into the acute injury bracket or the chronic injury bracket?
I don't think it is acute, because it should be coming in the other bucket, chronic bucket, I guess.
Chronic bracket, which is the overuse bracket. So you've
Correct.
heard it right because it's most likely the change in the intensity of the work and probably which I was not able to take that, the muscles were not able to take that for that moment. And
Right.
that probably led to that for her. It could be one of the reasons only, or it could be a bad technique. It could be any of this, but it didn't happen on an immediate basis. It
Yeah.
happened in a um,
Gradual manner. Yeah.
increment, right?
That's right.
Exactly. Very good. So that is your chronic injury. So
Yeah.
as parents, if we know this a little, we will be able to easily identify this and also work on it accordingly. And of course, us coaches as well as the therapists, we are also all in sync and we'll be able to work on it much better. So very good job there, and we will address the soreness part of it.
Sure. Thank you.
Awesome. Okay, so I'm assuming that anybody here has anybody has any doubts regarding the acute and chronic injury? Do you have any? If not, we'll move on to the next topic. You guys can also just react saying a thumbs up, thumbs down if you don't want to speak. That's all right. Okay, I'll go ahead and assume that there's no questions. So let's move on to the next topic that we want to do, which is your understanding the growth spurts aspect. Could you please give a confirmation if you're able to see this right now? The shift in the
Yes, I can see it, Lavanya.
okay. According to me here, it's seen that it's already changed. Yes, thank you, Geetha. Right. Now we speak about the growth spurt aspects of it. So all our athletes are ranging somewhere between 6 years to about 13, 14, even 15 years of age. Um, so those are the main things that main area or the period that we are looking at in this aspect. This is the time where the child or the athlete, I'm always going to try and work with as a child more than an athlete at the moment, for us to understand that this is a basic thing that will happen in everybody's life, and then comes the athlete component of it. So as a child, as we grow from 6 to 18 or even to 16 years of age mainly, there's a lot of bodily changes that's going on. Not only are we growing cognitively, we are growing physically. And in physical growth aspect, our organs are developing in very different paces for each person. The muscles are expanding, the bones are expanding vertically at a rate that is much higher than what it would be up to around 8 years or even 10 years. But especially for female children or female athletes from 8 to 13 years of age, is going to be exponential growth in terms of organ development, the menstrual cycle start, the change in the composition of the body in itself. Till then, most men and most women have almost the same composition, male and female children. But post this, because of the entry of the hormonal effect in it, the changes will happen rapidly. So between um, between 8 and 13 years for female athletes, between 13 to 17 or even 18 years for male athletes, the growth spurts are huge. Now, what is basically a growth spurt? Simple. It's nothing but it's a period where this rapid development, where it can land between few weeks to few months, which is why you see some kids suddenly grow up even without your knowledge. Like in few weeks, you see them gaining up to about 3 to 4 inches in height, and that can happen. So we can expect about 2 to 3 inches, or even sometimes 4 inches in terms of female athletes, and we can expect about 4 to 5 inches for male children, male athletes, in their growth spurt time, where they increase in their height. And the body composition, of course, changes for almost everybody, but more so for females than males because of the hormonal profile that gets involved. But apart from that, what happens during these growth spurts, during these few weeks to few months? Unfortunately, we can't give you an exact time of it because it's different from different people. For some people, it's just 4 weeks. For some people, it can be years. So we'll keep it as a few weeks to few months only. But what happens in these growth spurts is there's an increase in appetite. And it's expected, given that the body's need for calcium, need for all the vitamins and the protein intake in order to increase the length, in work on building that base. And this is where you see that your child is tending to eat a lot more, and no matter how much they eat, sometimes they can still feel hungry right after eating as well. So that's an expected reaction at this particular period. We have growing pains. Growing pains usually occur at the heel, at the ankle joint, at the knees, as well as at the hip joint. For some kids, it also occurs in the lower back, and especially for gymnasts, please expect some lower back pain because of these kind of growing pains. Um, there's a lot of hormonal changes in order to build it, in order to focus all the vitamins and all the nutrients in the body towards the bones to build a better skeletal frame, which is why you end up even having these growing pains, because the nutrition is getting changed in the directions of it, but the demand for that nutrition elsewhere is also there. Cognitively, they're working a lot. They're studying, they're trying to learn things, and every day is a new learning episode for them. Physically, they're working a lot. They're playing around both in their schools, and especially us gymnasts here. For our gymnasts here, they will be working almost about 2 hours, and for competitive athletes, so they work 3 hours, 4 hours. So there's a lot of physical demand that comes in, and on top of it, the body itself is taking it for regular building of its basic structure. So that is why your increased appetite suffices for this kind of conditioning too. It makes sense. So you need to just make sure that we work on the nutritional values as well, which I'll be speaking when we speak of the menstrual cycle too. So growing pains are expected in these regions. There's a lot of clumsiness at this point in time. The clumsiness can come because of a little muscle imbalances and a loss of coordination during this time. Um, Unfortunately, many children take this up in their adult life as well, saying that, hey, I am a clumsy person. It need not necessarily be. It is because of this particular phase that they're in that they end up starting to become more clumsy because of the muscle imbalances, because of the height differences. And that itself can lead to a lot of joint and muscle discomfort too. It's a cycle here. Joint and muscle discomfort leads to clumsiness with loss of coordination and focus. At the same time, clumsiness can further lead to joint and muscle discomfort. And there's also a lot of change in the sleep pattern that can happen. They might tend to sleep a little more compared to what they would be sleeping, because it's in sleep that we truly, truly recover, truly, truly build. So you can expect them to sleep a lot more. However, all of these come with a double-edged sword, meaning you will have to keep an eye out to make sure that you take the child to the ortho, the pediatrician, especially when there's severe pain, which is accompanied with swelling, redness, warmth. If there is any pain in a region which is accompanied with swelling or redness or warmth, any of these three, which is almost always, see, if there's swelling, it may occur without redness and warmth. But if there's redness involved, there's always swelling. So if there's severe pain and it's also with any of these three components, please make sure you see your ortho, pediatrician, or even a physio, but preferably an ortho or pediatrician, because if there need be for drugs in order to reduce the swelling apart from just the cold and the or the non-rehabilitative, I mean rehabilitative management part of it, it's good to take ortho or pediatrician's consultation, so that if there's any deficiencies that are also present in the child, that can be looked into, taken care of, and also supplemented with. So it's important you do this. So this is a sign to watch out for. The second sign that can be is you are in pain. So many children, they tend to downplay it as well. While some children come up and tell you, there are children who tend to downplay things. So if in case they're saying that hey, there's not a lot of pain, but they're unable to walk, they're unable to even sit, or they're unable to put one foot forward with full weight bearing on it, then that becomes a problem. So if there's any limping, any limited mobility area, that is when you should see the doctor. Any asymmetrical growth or extreme fatigue. So I don't know if you all have observed this. For some children, the upper body tends to be a lot longer than the lower body. For some children, one leg is much longer than the other. Now, this one leg being much longer than the other is called as leg length discrepancy. When there is leg length discrepancy is also when you can see a lot of limping and a lot of circular movement of the pelvis to move. When that happens too, it can in turn lead to a lot of back pain. So it's important that we make sure that we measure the limb length, which is why regular physio consultations are important. Because when you're having these regular checkups, a basic I don't know if you all remember this, or if were there in 2019 also we did something like that, where we have a dashboard, we have your regular measurements. The baseline data is available, so that we can go ahead and use that to compare ahead as well. So the asymmetrical growth has to be taken care of, or has to be looked at, seeing that is it more to do with the growth per se, and if it is physiological in nature where you can't do much, meaning if it is more to do with the bone and the muscles themselves, then we'll have to go ahead use some insoles to make sure that the height gets corrected for the child. Otherwise they'll end up with back pain. Otherwise they'll not be able to perform to the best of their capacities. If there's extreme fatigue, being tired, feeling that sense of weakness right after working out or right after a strenuous activity is expected. However, if that prolongs for continuous days, like 3 days, 4 days, or even 5 days to an extent, then that becomes a problem. So please make sure that you keep talking to your children, understanding how their regular patterns are, so that you can identify the extreme as well. Okay. So it's important that these are the where you have.
Hey, Lavanya, you are as host can mute them, whoever is.
Let's see. Yeah, they're muted. That. Um, yeah, that can happen. So during these times, when you are going ahead and taking care of these, how you eat and what you do will matter a lot, especially during the growth spurt time. Presence of calcium and vitamin D are extremely important, especially because the growth plates are expanding and are growing. And it's important that if in case we are low in it, we need to supplement that, be it supplement in terms of food that are fortified with calcium and vitamin D. It can also be sometimes an external supplement given by your ortho and pediatrician in order to have it. So calcium and vitamin D extremely important during this time. They are the building blocks. We have iron and zinc. Iron and zinc are it's like this. There is oxygen present. There are nutrients present. Like say we need something and we have enough things in the go down, but if there are no transport vehicles from the go down to the area that is needed, if something has to come from go down to RnR for it to work, your iron and zinc are the main components that are going to go ahead and do this. They are your trucks and lorries which are going to drive these items from the go down to the place that needs to be worked with. And in our body, how it works is iron and zinc will carry the nutrients, especially the oxygen, and all the hemoglobin as well. So they are carried very well, and they help and give the nutrients to the areas that are being built to grow. vertical expansion as well as horizontal expansions. They're the ones who are really making the base. They're making the makeup of your body. So it's important that we go ahead and fortify our foods with iron and zinc, or have foods that are fortified with it. Like for example, oats. We have sometimes red meat. We have all the nuts and green leafy vegetables. So these eggs, all of these are going to help with both calcium and vitamin D um, supplements, as well as iron and zinc vitamins. So minerals and vitamins. Proteins. Again, we all know that amino acids are the basic building blocks of our body. Proteins are a building, the main cement that builds our body, because without proteins, we don't have enough amino acids to build the base. So making sure that we're having good eggs, chicken, fish also because of their omega-3 fatty acids, which in turn is going to help with the entire makeup and the fat makeup of the body. So proteins, like it can even be your lentils, it can be your beans, it can be your um, curds, yogurt, whatever the child is okay with, and having this balanced diet but also fortified purely of these is going to help you out. So making sure that you're filling the child with proteins, iron, zinc, calcium, and vitamin D will help a lot in terms of managing and reducing their pain during the growth spurts. But more than all of these combined, we it's going to be topped up with something we call like the sleep and the recovery pattern of it. When we say sleep and recovery, we say it for these reasons of making sure that the child is having enough water intake. With water, making sure there's enough electrolyte intake, having about 200 to 250 ml of some lukewarm water with some salt, honey, and lime every day in the morning. Some We can probably have some electrolytes like the tender coconut water, the buttermilk. All of these will help with the recovery process and also supply the nutrients that are needed, be it the vitamins and minerals. Sleep is where the body really builds, because there's no other function that's happening. There's no cognitive effort that's happening in terms of doing anything else. We don't have to expend our energy more. And it's in sleep that we truly, truly recover and truly, truly grow. If you've seen, when there's a sudden, quick spurt of cortisol coming in, we tend to feel active. It's needed. Cortisol is absolutely needed, but it's not as sleep is going to tackle it in such a way that it is optimal for us, but at the same time we grow exponentially and safely. So good 8 to even 9 hours of sleep for kids at this point in time is not a problem. So you can expect your children to go ahead and sleep better. And if they're not, if it's being disrupted by, say, a tab or a phone or electronic devices, or even studies for that matter, I'm a little biased in this. Sleep before anything else. Please keep that in mind. So that's about growth spots. Do you guys have any questions on this?
Lavanya, one of the biggest concerns was, uh, especially when the girls have their periods, their menstrual cycle, should they come for practice? Is it, strenuous? Is it too, should they not come in for a few days? So, how would you address that?
Perfect. That is the next topic that we're talking about. So
Perfect. Okay.
this is the next topic. Can you see the period slide?
Hey, just one
Okay.
comment before that on the growth spurts. Lavanya, there was, I know Erin went through this phase where during her growth spurt, I think her back used to pain a lot. And there were two schools of thought. One was completely rest and then come back. The other one was train it till the point where you can and then come back and rest. Which one would you suggest that we do?
So excellent question, because it's very subjective from one child to another. But if we have to give a general consensus, I would always say go with what the child can take, because they're athletes, they're not just regular children. Whatever we would have gained will go into a loss if we go into a complete rest. There are certain situations where we will need complete rest, especially when the child feels burnt out or cognitively overloaded that they don't feel like doing it. That's when you absolutely take off, give that time to recuperate and come back. But otherwise, if the mental makeup is fairly okay and it's only the physical pains that they're dealing with, then I would always say that do as much as they can, and also do things that are going to help with those pains, like rehabilitation, strength training, mobility training. Mobility is not just flexibility, like we've addressed this many other times, making sure that the joints are functioning well. So it need not be that they go into hardcore training, but they can still work with rehab exercises, mobility exercises, flexibility drills, strengthening, and then slowly move into the higher intensity work as the body allows them to. So that would be my answer.
Lavanya, there are some chats that have come if you want to address them now, or
One moment. Yeah, there are three. So we can actually do that.
It's basically around plant protein and diet for vegetarians that kind of help with the vitamins and minerals that are required.
Sorry, I can't see the messages. Yeah, there we go. Okay, so just diet for vegetarians ensures the demand for these vitamins. Safe to be given to kids. See, protein powders are a big debate given the quality of protein powders that are present in the market as of now. We fortunately had a conversation. Three of the team that I used to work with, the nutritionists, and all of them were still against protein powders, even for adults. So forget about children themselves. But given that they're athletes, yes, we'll have to increase our protein intake a little more. And as long as the protein brand that we're coming with, or if you can make it at home, it'll be even better. Then you can go ahead and give them the protein powders, to the best of my opinion. But I think we should still consult a sports nutritionist per se for it. But in a general conscience, I would say it would be okay provided it's in single doses. Like, for example, only one scoop in a day and not more than that. And the source of protein powder is good or homemade. So that can be done. Um, the second part is, which is the best source for vegetarians? All your grams can be a good source for it, but it also comes with a lot of gastric related issues. In lesser quantities, it can help. Milk can help as long as they're also with some turmeric and pepper too. Their bioavailability increases. You can go ahead and consume a lot of green leafy vegetables, a lot of citrus fruits. As much as they contain more vitamins and minerals, they also contain a lot of protein in them. So it is mostly what we are eating on a regular basis. Beetroots really help, beans really help, uh, but we're going to have to work with a little higher dose through gram proteins for them, for the children, so that it's easier for their bioavailability. But what we can do is speak to the nutritionist so that the right kind of foods are mixed with each other in order to make them more available for the child. Sometimes curds are not taken very well with children. So if that is not, then we'll have to eliminate it from the diet routine. Like that. Any other question on this?
Anaga has asked about some walking side bone. Is that common?
Sorry, I lost
She
you.
said she said there's while walking the side bone beside the heel of the foot is always painful. Please suggest what can be done
While walking the side bone. Sorry, what?
besides the heel of the foot.
Is it the inside towards the opposite leg or outside where there's no other body pain?
Anaga,
Inside,
Mm, inside.
Lavan, inside.
Oh, got it. Inside. Um, okay, let me first speak of this part where the pain along the inside of it. Um, okay, is it only while walking, or is it even otherwise when you're just sitting and doing nothing as well? Can you maybe come on call so that's easier to communicate?
I guess she's in a meeting. What you can do is take a one-on-one later with her. Then
Yeah,
no
yeah,
problem.
we can do that. That'll be
Let's just
better.
continue. Yeah, yeah, she'll be fine with that.
Done. And Mira Sharma is asking, start with a spurt, 2012 refuse. When we know it's a good spurt, girls at the age are also growing aware of being pat or plump. When it's easier. Fair. Um, when do we really know if it's a growth spurt? Is when they start feeling the so many girls, we'll speak about this in the menstrual cycle as to what the discomforts are, and that'll be easier for us to work with as well. So let me start with the menstrual cycle part of it, and then I'll be able to answer this along with that, Meera. So, Anaka, you go ahead and just book a one-on-one with me. We'll actually address this with the rehabilitation protocol.
Oh, okay, sure. I'll do that. Sure. Thank you.
So now we'll speak about the training during the menstrual. Beautiful, beautiful topic because one majority of our athletes are females, but to a large extent, even it's good for even the male athlete parents to know all of this, so that it can be supported during training too. So what happens during a menstrual cycle? We have mainly four phases of the cycle that's happening, and this is not just for athletes. This is even for all the female caregivers within the team that can take all the notes here. See, actually, let's go down to the nutrition part of it first. Do you see this? So we have the four phases. First is your menstrual phase, where the bleeding occurs. So that is between your 1 to 6 days. In other cases, of course, there are 7 days, there are 8 days that can happen as well. Now, these are the cases that are not regularly seen per se, but you will see all of this. But especially in athletes, you will tend to see lesser than more because the body is already expending so much of energy that the body will try and hold back as much of energy, which here includes blood, in order to hold on to give that energy in order to do the work that is needed to be done. So because these guys train a lot and there's a lot of muscle building and breaking and building and breaking that's happening, it takes up a lot more energy. So what can happen over a period of time? The adverse effect is something called as the female athlete triad, which we will come to later if it's needed. But the whole point is the average is between 1 to 6 days is your menstrual phase. So day one is the day you start bleeding. And in this time is where you go ahead and focus a lot more on having citrus fruits, the green leafy vegetables part of it, a good protein intake of it. But this is also the time where they feel low enough, which is why they might want to eat something that they like, and which is almost always a sugary uh, or a junk aspect that comes in, which is okay to a large extent as long as it's in a much controlled quantity. But the foods to definitely avoid in these times would be the heavy processed foods as well as the fizzy drinks. Try your level best to avoid it, but of course, with the child, it will be a little difficult. So maybe lesser quantities is going to help us out. So 1 to 6 is your menstrual phase, and then comes your follicular phase, which is between 7 and 12 days. In this time is where the body is going to start working towards ovulation. So that is where the body is going to start thinking that okay, I'm going to start prepping towards this phase, that is your ovulation phase. For that, you'll need a lot more slightly fatter contents, which is why you tend to focus a lot more on your fresh fruits again, veggies, but nuts and seeds here. So this is important. Not all nuts and not all seeds will suit everybody. This is going to be, you can get an allergy test, or it, worst case scenario, it becomes a, you'll get to know that hey, this doesn't work out for me with either itches, hives, rashes, and just an allergic reaction that can come in the lesser phases. But if you already know that you're absolutely allergic to it, please don't consume those nuts. But in the follicular phase, between 7 and 12 days is where you're preparing for your ovulation phase. And this is what you go ahead and eat. If you see, there's a mild mix of follicular and ovulation because for us mainly, we are going to focus on follicular phase per se because it's also the time where you can actually work out well. The child will be full of energy, they'll all have more cognitive presence, they're a lot better in terms of physical as well as the mental apparatus. In ovulation phase, the foods that you should definitely focus on is again slightly high on fat, but the good fats. We have your avocados or any the eggs, all high protein foods which are all lean meat, as well as the fish that you can eat, and green leafy vegetables to boost it. High fiber ones, celery is something that you can have, beets is something you can have. They really work well. And after the ovulation phase is where you'll have to focus on bringing down the exercise intensity, which we'll speak of, but also focusing on high fiber carbs a little, because mood or the changes in the mood can happen a lot in this phase. And the reason being, from menstrual cycle to the ovulation, or rather from the follicular phase or mid of menstrual phase to the ovulation, estrogen has taken over. So estrogen is the hormone that is you that'll keep you a little happier and a little better, and you, mainly you, and you're not losing your mind, kind of a phase. But from right after ovulation to the menstrual phase, it's the progesterone that goes ahead and takes over. Of course, we have the FSH, LH, all that. Let's keep that aside. But mainly, if you're looking for estrogen and progesterone, these hormones are going to play a lot in terms of how your mood is, how active you are, how upcoming and how okay you are to do a particular physical activity. So if you're making sure that you're also eating accordingly, it'll what can I say? Um, what is the word? It's like you're optimizing it. You're optimizing the best of your the energies that are available according to the hormones. And these hormones don't change, be it a child, be it a grown adult. So we need to understand, if we try and do this, we'll have a better hormonal cycle balance, which in turn is going to give us better gains in terms of um, strength training even over a period, and also injury prevention. Because in a bad mood or in a bad energy level, if you go ahead and try and do a very high intensity drill without even being aware of it, higher chances of an injury presence. So in the luteal phase, we need to focus a little more on higher carbs, because carb is finally the food for your brain, and your brain is a little sharper during that time. But a lot of magnesium rich foods, such as the dark chocolate and nuts as well. Okay, but in general, please avoid the processed food. But given their children, it's difficult. Just make sure that the quantities are good, and it's always done in the first half or right before their training than after their training. So after their training has to be really good, clear, clean food. Compared to before is still fairly okay. But of course, pre-workout meals are also very important. What I mean by before is, make sure that whatever junk or whatever processed food we're having at that time of the day before they have to go into like 1 2 hours of their workout, so that it's easier for them to also burn with it. But then when we speak about the training aspect of it, this is how it looks. According to the phases, we can go ahead and train. To answer the question of, are we supposed to be training, are we not supposed to be training during the cramp, again is very subjective. Because when I was a child, it didn't matter. Like almost for about 7 years or so, I didn't feel anything. I was super active through all phases of it. There was absolutely no hormonal changes per se that affected me. So there was no change in the intensity of the work that we were doing in terms of our sports or in terms of our training. And I was into dance, so into the dance as well. But here again, because the training intensities are fairly higher, if you're only doing it twice in a week, it's different. It will still be a little lesser. But for say competitive athletes, when you're doing it on a regular basis, here it becomes very subjective, and it becomes very tailored to the athlete and the child. So during menstrual cycle, I would always by thumb rule say that keep it light. Keep it light in terms of, it's not a step back. In fact, if we can work with mobility here or any rehab exercises here, or simple coordination training. Coordination training is missed a lot. Not here, not I'm not saying here per se. I'm saying everywhere coordination training gets missed out a lot. So we can work on more finer skills, which doesn't take a lot of the body's effort, but takes a lot of cognition into it. We can go ahead and work with that. Low intensity, low aerobic drills as well as strength drills, because rehab exercises will be focused on strength mainly. So simple walking, cycling, to an extent, water work if it allows them to. I wouldn't suggest particularly hiking and all, but these are the examples that are there even for the other females who are not athletes here. They can take it up. But basic flexibility and mobility drills can be done here. You need to make sure that you focus on a lot of cognitive work like visualizing, making sure you meditate, breathe. Kids definitely difficult, but they can definitely work with breathing exercises and visualizing where they want to get, visualizing skills. So if you are having a lot of cramps because of the hormonal change, if you're having a lot of back pain, abdominal pain, leg pain, and if anywhere on a scale of 1 to 10, Anything is above 5, please rest it out. If it is below 5 or at 5, go to the gym, stick to any light intensity drill. It can be as simple as sitting and looking at the skills. It can be stretching, the rehab exercises, all of it. Whatever you can do, please do. It need not be core work, because core work there would already be a lot of cramps there, so you don't have to do that. But instead, you can focus on other regions of the body and work with it. So, this is when the cramps are going on. But apart from that, I hope that answers your question, Mrs. V.
Yeah, sure.
Yeah. So after your menstrual cycle is where you have all the energy possible, and this is where the coaches can also make the best of it. So in the follicular phase as well as the ovulation phase, we can go ahead and do a lot higher intensity exercises, higher strength training, power training, a lot more SNC as well as higher skills training can be done during these two times. But again, when we go back to the luteal phase, when from the 14 days back to the 28 days, again subjective to the athlete, but most of them will be okay in this phase. But about 1 week before the period again sets in, before day one, in that 1 week, if you can go back to lower intensity strength, lower intensity aerobic drills, it'll be a lot easier. But not as low as during the periods, but just before. It can be moderate to low in this case. So if we can work it like this, it'll be very helpful. But if the only question comes in is, hey, during cramps or during periods, do we work out or not? Subjective. Above 5, rest it out for at least that 1 day to 2 days, and then get back into the gym. Below 5, go into the gym, or at 5, go into the gym, work with lower intensity work. And even in the above 5 part, there are researches and also a lot of practical feedback that has come in saying that the more you walk or do any lower intensity drill that you like for example, some people like dancing, some people just simply like what is that word? They definitely like static cycling and cross training. But then if you like some drills and you can do it, please go ahead and do it. But walking helps. Walking as an exercise is a miracle. You have to go ahead and do that. And even if you want to just stroll away, that is a very good deal. So this is how you can do during menstrual cycles. Any questions here? Okay. We will move on now to
I'll
the.
just like to add one thing, especially to parents, because the girls might not go, especially to a male coach, they might not go and say, I need to have a low intensity workout, or, obviously they'll be shy, and they'll completely negate the parents on that front. So maybe parents, you could just tell them to, just tell Chitra that, ma'am, I have cramps. Just can you tell sir to go light? Or maybe they can just go and tell the sir that she's got stomach cramps or something like that. So, the coaches will understand that the intensity should be low. Thanks.
Communication within the team of athlete is going to be super important with the parents, with the coach, the child itself. If we can train them to communicate better, also it'll be helpful. If we can be more open to their pains, definitely more helpful. If we can track these cycles and most likely where the phases are, it'll be definitely work help. And regarding that question of how do you get to know whether it's a growth spurt or just another pain, especially with the feeling of being fat or plump comes in, it's especially during this time that you feel the discomforts and the pain cramp in the body.
Oh my.
So we work with these sudden muscle cramps, which can be anywhere and everywhere. It need not necessarily be in abdomen. The feeling of bloating that comes in, where you feel the tightness in the abdomen than the fat in itself. Fat in general, especially for females, is soft. If you touch it, you'll be able to palpate very well. Whereas if it is bloating, the abdomen really bloats up like a balloon, and that hardness can you can realize that this is bloating and this is not fat. And that way we'll be able to explain it to our children as well, saying that this is not fat, this is more about bloating, and this is more about the cycle. Um, in terms of females, you'll usually see this much lesser in females. We'll see that more in men as well, because estrogen to a large extent protects us. But for men, it's mostly adrenaline and cortisol. So you'll see a lot more heel pain and knee pain, everything in male athletes. And it's a lot clearer for them. But for females, especially with the abdominal region and the fat aspect of it, this is how you can explain that the bloating aspect of it and the irregular muscle cramp aspect of it, especially in the calf muscle, glute, and lower back. So that's how you can differentiate if it is growth spurt or a period pain itself. So we speak of that, and now we speak of the soreness and the injury aspect. Simple topic here. It's actually, if it is soreness, it usually comes in after working out, after any exertion that is being put by the muscles that are present. So it will be usually present also in the area that is being used to put the exertion. Like, for example, if you're doing a simple squat exercise, then you will feel that you will feel the soreness that will set in sometime in the quads area, in the glutes area, to an extent sometimes in the hams area. But whereas if it is a sharp pain per se, it will not allow you to go further from it. It will be present either during the exertion or right after the exertion is done. So it will be very, very sharp in nature. But whereas in soreness, it's more of a dull, aching, burning kind of a sensation that will come. It usually comes in from 24 to 48 hours, depending on the intensity of the work that you've done. And for many people, there's no soreness also present that comes with conditioning. But in pain, it's almost always there. It is sudden, immediate, and it happens during or right after the exertion. Soreness can last anywhere from 24 to 72 hours, again, depending on the intensity of the exertion. So we wait. We wait for almost 5 days to 6 days before we go ahead and consider this as a complete pain. And of course, this is apart from the absolute symptoms of pain. If it's just more about on a scale of 1 to 10, if it's around a 5, we go ahead and wait, do all things that can be done in order to reduce it. So this addresses the question that came in the very beginning as to how can we work with soreness and pain. So that comes with the next point. In injury, in soreness, it lasts anywhere between 24 to 72 hours, and it also gradually go down after that. But in pain, it depends on the intensity of the injury that has happened. It can last anywhere between 3 and 4 weeks, depending on how bad the injury is. Okay. Now, how can we work with soreness? Please eat well. I mean, this is like the most underrated work there is. Please make sure that you eat really, really well. Good protein and carb mixed diet. We need to make sure that the water intake is really, really good. Good electrolyte intake. Good sleep levels. Without sleep, you will not recover well. And apart from this, we can do mild to moderate activities to that region. So, this is where the problem comes in. If I'm having soreness in my lower body, there's nothing stopping me from doing a full blown workout for my upper body. So please make sure that when you're doing this, keep lower intensity to mild to moderate intensity work for your lower body. But for your upper body, if you still want to go ahead and push it, you can. There's no problem per se in that. Okay. So when you're having this, stick to mild to moderate activities for that particular region. Whereas when you're in pain, depending on what kind of pain or what kind of injury caused that pain, it can be. So there are two types of injuries that we also speak of. There's something called open injury and there's something called closed injury. When you have a fracture, it can be both an open or a closed injury. Let's take fracture because this is something that you guys would have seen more. If a fracture in which the bone is popped out of the skin, there is a lesion on the skin and there is blood, and if you can see the structures under or within the body, now that is an open injury. It's a closed injury if you can see that there is something that is moved from its place. There is swelling coming up, there is warmth there, but there's no abrasion or there's no lesion that is present, and it's all the skin is completely intact. Now that is a closed injury. So, of course, depending on injuries, the way we work differs. But keeping in mind, let's take closed injury as of now. You'll have to rest it out. You'll have to use ice for this, which again we'll come to later. And you compress that region based on.
टीवी रिमोट दो तुम तो कोई गप वप देखती नहीं हो उनका
Also, you elevate that region further and also
नहीं
give it enough supplements and anything that is necessary. Like, for example, there are certain injuries, like, for example, if it's tendonitis, right? Now, if that is a sudden flare up that is there, then there are people, I mean, so we can go ahead and apply or rather take some supplements which is going to help them out. Some are given collagen, some are given to an extent right now even creatine. So let's not get into that. It's a whole area in itself. But the whole point is we can take certain medications or supplements also to help the pain. So this is your main difference between soreness and pain. It usually goes away in 3 to 4 days. If it doesn't, that's when you have to also look into it higher. Depends on the intensity and the functional disability it is giving us. Is it not even letting me move anymore? And then what am I supposed to do? So the intensities change. It's almost always managed by managing the load that we put on the muscle. So make sure that the load management, be it the skills load or the SNC load that we're putting on the kid, is very, very gradual and progressive and nothing sudden out of nowhere. Especially if the athlete or the child is coming in after a break, it has to start almost like it is new, but of course tailored to their proficiencies. So this is what we have to do. Now, is that clear? I'll take it as it's clear. Got it. Now, hot and cold. I actually didn't want to make a slide for this because there's a lot of information out there. There's a lot of confusions out there as to what to use when. If you guys can please interact with me in this, it'll be very helpful. If I have a swelling, but I also have, okay, let me rephrase that. Okay, say suddenly I bent forward, I tried to lift a 5 kg dumbbell off the floor. And after that, I was able to do everything. I lifted the 5 kg dumbbell. I was able to do the exercises that I wanted. But while I was lifting, there was some pain, which I ignored. But after that, for the past, say, 4 to 5 days, that mild pain that is there is continuing to be there. What do you think I would be using in this time, in your understanding?
You mean will we use a hot pack or a low pack? Is a hot pack or a warm pack? Is that
Yeah.
what you're asking?
Yes.
Oh,
What would
okay.
you use, hot or cold?
If yeah, cold pack, I would also go with that.
You would go with cold pack. Okay. Why? Alternate. Okay. So Mrs. V said cold, and then Supriya said alternate. Hold on, I'm trying to get the message. Cold pack, and alternate. For a short period, it is cold. Okay, all right. So if you can just, if it is chronic, then hot. Okay, fair. Thank you for letting me know that. So, by the rule of thumb, in my practice, what I practice is, especially if these the kind of pains, especially if it is lower back region, and if it is something that is there for about 4 to 5 days, I go with something called as contrast bath, which is your alternate program that's been written. Contrast is nothing but a combination of cold as well as hot. Hot will always be a little more compared to cold. But the rule of thumb is like this: if there is any swelling and if there is any sudden injuries, then we use cold. As simple as that. So, if by chance I twisted my ankle, there's a lot of pain that is being shot up to the brain. The brain is able to perceive a lot more pain than it can at the moment. That is at that point in time is where I go ahead and apply cold, whether I have swelling or not. Cold basically numbs out the pain. That's all it does. So it numbs out the pain, and if there's any swelling in the region, which is very normal after an injury, the body's supposed to swell things up, and that's how better recovery also happens, better repair of the region happens. You can go ahead and control that swelling through cold packs. Cold pack reduces the swelling, cold pack numbs out the pain. So situations where I would use it is if there is swelling, then I use that. And at the same time, if there is uncontrollable pain and if it is a closed injury, of course, you can go ahead and use some cold packs to help it out. But this is also true for areas which are more jointy and more tendony in nature. When that happens, it's easier for you to use cold and work with, and will reduce the swelling as well. But when it's more muscular in nature, when it's more stiffness related, and if it's present for a much longer period of time, that's when I go ahead and use hot pack. If swelling helps recovery, should we control the swelling or let it swell? Very, very good question. So that is the main debate that comes in. What we prefer in our practice right now is we don't go with cold, especially for female athletes. We go with room temperature water. I wouldn't suggest using cold unless you really are unable to bear the pain and you want to reduce it. Let the swelling be according to how it has to be for a while. Use room temperature water and let that calm down a little. It's like we're just slightly helping the swelling to come down a bit, or rather, the pain sensation to come down a bit without affecting the swelling too much. It will gradually get down. The body has its mechanism to get it down as well, but elevation of the leg and compression of that region to an extent to give stability to the region, so we don't go into another like for example another ankle injury or another ankle inversion sprain. That is when we stop it. So instead of cold mainly works on men. Room temperature water works better on females, but I wouldn't put cold unless it's really really needed. Some swelling is important, a lot of swelling. Imagine if something is wrong here, this this big can be a swelling, this big can be a swelling. Anything that comes up to this big needs immediate attention from the doctor, because that is completely abnormal. There can be a break in the bone inside, or there can be a complete tear of the ligament. So if there's a mild swelling or moderate swelling, what we're looking at, I would still say use room temperature as a general rule. So, swelling, cold, no swelling, hot. Back pain, neck pain, all these areas, hot will work a lot better than cold. But if you feel like, hey, hot is not really helping me out, you just switch to a contrast method. 3 minutes of hot followed by 2 minutes of cold. So, 3 plus 2 is 5 minutes. You do that for 3 to 5 cycles and you'll feel a lot better. Is it okay to move the body part when there is swelling? It is, if it is allowing you to. Some people cannot move if there's a lot of swelling in that region. Like I said, if it's very high swelling, it needs immediate attention. But if you're speaking of mild to moderate, moving is okay, walking is okay. In fact, staying stationary might increase the swelling because the lymphatic drainage is not happening well. So it is okay for you to move, but only as much as the body allows you to move. You'll have to be careful there. So there are tissue stops that will come by the body in the such times. So today, if the body is allowing you to move this much, that's fine. But tomorrow, it might even allow you to move here. So you'll have to listen to your body and work with it.
Lavanya, just repeat the 3 minute hot, 2 minute cold. When is this to be done?
Preferably
Sorry.
twice. Preferably twice a day.
No, and when the you want to reduce the swelling or
Like that. So, say the athlete just fell. So, right after the injury or the event, you go ahead and do that. And after about 4 to 5 hours, again you repeat that. 2 to 3 times in the day shouldn't be a problem, as long as there's about 4 to 5 hours of gap in between.
okay.
Any other questions? I am going to share all of this with you, and I'll also be sharing one habit tracker, which can be used also as your period tracker. And when I'm saying period tracker, it also helps with mood understanding and the feeling of, am I feeling tired? Did I sleep well? Did I not sleep well? All that comes in. So I will be sharing that as well, at least by say tomorrow. And you can go ahead and use this as a regular practice for your child, and even for yourself. And it becomes very easy for you to understand what your body is going through at that particular point in time for you to make any decision about it. But if no other question is there, then we're good. Awesome.
Hi, Lavanya. I have a question.
Hi.
Uh, so my daughter doesn't do the competitive level of gymnastics yet, but what would make us go for a physiotherapy session? What should be the factors we should take into account?
Okay. Before I answer that, is there any pain at the moment, or are you asking in general when would you visit a physio?
Yeah, I mean, it's in general because we hear from parents of competitive level and they say that it really helps. Now, I've been doing the massages myself till now. So, when do we know that this will require a physiotherapy level of massage or sessions?
Okay. If you visit a physiotherapist, they're not only going to work with releases per se, they'll do an in general understanding or rather an assessment of the body. There will be physical assessments of the body where there are musculoskeletal assessments, there is aerobic assessment, the strength component assessment. So all of these can be taken care of when you go to the physio. So in general, if you're looking at general body health, it's good to have a regular checkup with your physio at least once in 3 months, especially for a child because they're growing, right? The growth spurts can be pretty quick, or even in general, once in 3 months, having an understanding of it and checking your baseline data, like for example, the limb length, making sure that the limb length is accurate, and if there's any changes, is there any muscle weaknesses that is leading to the limb length discrepancy, or is it the limb length itself is growing higher, which is leading to a muscle weakness on the other side? So that part of it. That way, if you have a regular check with your physio once in 3 months at least, then you will have a basic makeup that will be available for you to track and we can work with and prevent things from happening. One. Two, say your child has this nagging back pain and they just want to get it checked out. The first contact would be physio, then ortho. So, like that, if there are any mild pains that has been nagging you for a while, any pain related issue, you can meet the physio almost immediately. Give it about a day's time or even 2 days max to max, given the details or the data that we have given you today. But apart from that, please meet your physio. Does that answer your question?
Yes, it does. Thank you so much.
Yeah. Next, I see that there are two questions. One moment, it's just opening. Is it okay to get a massage for a 10-year-old? See, okay, I think there's a slight misconception. A regular massage, anybody can take. It's actually very good for you, right? You can go ahead and take it. But a deep tissue massage or a deep tissue release, or what we do in terms of the kinetic chain releases, are very
And
painful.
what Lavanya does is very, very painful. My children have gone through it and they
Only
will
the
not swear by it. But
Yeah, so it's very helpful in terms of, I'll tell you when that's usually needed. You see a lot of training. When we train a lot, what happens inside the body is basically we're breaking that. We're breaking the muscular structure to a micro extent, and we're rebuilding it. And then when we are rebuilding this, when the body rebuilds it, there's a lot of collagen store that comes into that picture. And when they don't get stored well or they don't get laid on like cement very well, there can be tightnesses within the fascia. There can be tightnesses or non-movement of the muscle to the most optimal extent. So we palpate it, we understand which is the chain that is more affected, and then we release it. But this release is a little deeper, it's not superficial. So it can be very, very painful. And I hats off to the kids who really take it and still come back to take it, because honestly, it's very uncomfortable. For a 10-year-old, I've had kids who came in as 10-year-olds and ran back saying that they couldn't, which is understandable. So, if you give them regular massages at home, which is going to keep all of this in check already, great. But if you feel that there's a lot of tightnesses, especially in the hamstring, calf, and lower back and glutes, which is the most common areas for tightness, then that is the time you go ahead and get the child to the physio. And of course, we can modulate the intensity as to the best possible capacity, but it's still not going to be a comfortable massage or a release. So, 10-year-old subjective if they're able to take that kind of discomfort. If not, and also if they're in that level of competition. If not, we can stick to regular, slightly moderate intensity massages on a regular basis, once in a week kind of basis at home, and hopefully prevent the tightness from setting in. The second question was, I hope that answers your question. My daughter had neck spasm 2 months ago. Still, sometimes she complains after a gymnast session. Please suggest what to do. we'll have to have a one-on-one to get a understanding of what the problem is, and only then can I suggest what needs to be done. So please go ahead and book one, and we will work with it. But if it's only happening after the session, then that is stress induced. So we'll have to look into strengthening, but I cannot completely tell without an assessment.
Lavanya, what about using of a gun?
Not suggested in certain areas, and definitely not suggested for kids.
Okay.
The growth spurt concept of it. It's building, and we don't want to unnecessarily, disrupt that process.
So better for them to use a roller or any kind
Better
of
for
tightness. Yeah. Okay.
Absolutely.
Got it.
Better for them to use a roller and for parents to do the massages. Plus, never do it on sensitive areas where there's abundance of. Okay, sure. What we have to be doing is never concentrate on these areas like the front of the neck, sides and back are fine, but front of the neck, on the spine, behind the knee, just at this area that is the bicipital fossa here, at the elbow. All of these areas need to be not touched in terms of even regular massages. So we have to keep these things in check.
And what's the reason for that?
Mrs. V, what happens is in these regions, all the arteries and even the nerve structures are present much superficially. So when you go ahead and do that, like for example, if you go ahead and keep massaging in this area, you can reduce your heart rate and the blood pressure also drops. So we don't want to do that. And even behind the knee, the presence, the clusters of nerves and the blood vessels that are present are much higher and more superficial. So if you the high
Right.
chances of injury on the pressure,
Sure. 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 Okay. Got it.
which is why we can draw blood out from these areas easily. Any other questions? I'm sorry for taking a bit more time.
No, go ahead. Go ahead.
That's that. Yeah, that's about it. Please try and track. Please maintain a habit tracker. But apart from that, if you have any questions, please reach out anytime.
All right. Any more questions, guys? I think Lavanya's pretty much done with what she wanted to share. So yeah, the main objective was to touch on soreness versus like acuteness, acute pains, and then also on this whole menstrual cycle. Should we not? Things like that. So, any other questions, please? Now's the time. Otherwise, we can close. Thank you very much, Lavanya. This was super awesome. And yeah, you can share the same, and I will go ahead and share it with the group once you have it. You sent it to me.
Yes, sure, I'll do that. By tomorrow evening max, you should get all of them together. Everything's ready except the habit tracker. I'll share
Sure,
that
sure,
with you once that's done.
sure, sure, sure.
All right.
All right. Yeah, I think Lavanya, you I can I share your contact with parents and then they could reach out to you, or but you will be
Sure.
super busy since you are going to travel. So
Yeah,
let me know
that's all
what
right.
works.
You can probably leave a message. You can share the contact, Mrs. V. They can leave a message, and I'll get back to them accordingly.
Fair then. All right. Okay. Thank you, parents, for joining. Anybody with any questions, or can we close? Thumbs up, please. Thank you, Lavanya. Thank you very much.
You're welcome. Thank you guys
Thank
for
you,
joining.
So,
Lavanya.
I'm trying to stop the recording. One moment.
thank you, parents, for joining.